ever get that feeling, like you're kind of always a little behind when it comes to social stuff. Like everyone else got the memo and you just missed it.
Yeah, I know what you mean.
For a lot of women, this feeling, it's like their everyday normal. And it often comes from, well, from living with undiagnosed autism.
And what's really kind of wild is just how many women we're talking about.
Right. We're diving into those excerpts from Cheapaba, Understanding Autism Spectrum Disorder in Adult Females Today.
Right.
And it highlights that nearly 80% of autistic females, they're undiagnosed by the time they reach adulthood.
Yeah.
That's huge.
That's a lot of people.
So where do we even begin to unpack this disconnect? Where's it coming from?
Well, a big part of it goes back to how autism was viewed, like historically. Most of the research, it was so male-focused. And so the diagnostic criteria, it was all kind of built around what researchers were seeing in boys and men.
So the tools we had to identify autism were, in a way, searching for the wrong things when it came to women.
Exactly. And that's where this idea of masking comes in. And it's not about being intentionally deceptive or anything like that. It's more like a subconscious adaptation,
Yeah.
Like imagine this constant pressure to fit in, to meet these social expectations.
Oh, totally. Be agreeable, be outgoing, be the life of the party.
Right. And for autistic females who might naturally process social cues differently, that kind of pressure, it can be a lot. So they end up masking their true selves.
They adapt to try to fit those expectations.
Exactly. They suppress their natural tendencies, their reactions, all to try to blend in.
Okay, so that makes sense. But then how does this whole masking thing, how does it differ from how autism often presents in males? Because often, at least what I think of is more, those outward signs, right?
Absolutely. And while those outward signs definitely exist in females too, masking, it often results in more of an internal struggle. Think about it. Crippling social anxiety because they're constantly trying to decipher these social situations. Or emotional exhaustion because they're always on putting on this act to meet those expectations. It takes a toll.
So instead of, say, like a classic meltdown, you might have a woman who's silently battling a sensory overload at a party.
Yes. But on the surface, she appears fine, and without those more obvious outward signs.
It's easy to misinterpret what's really going on.
Exactly. She's just shy or overly sensitive. We slap a label on it without realizing what might actually be going on underneath.
And then, of course, diagnosis gets delayed.
Exactly.
And I can't even imagine the impact that must have, going years, decades even, without understanding why social situations just feel like, I don't know.
Like a minefield.
Yeah, like a minefield.
Yeah, it's tough. And that's where, this cheap ABA source, it really digs into some really insightful stuff about how autism, how it can actually look different in women.
Yeah, for sure.
Like one thing they challenge is this idea that women with autism, that they don't have that social motivation.
Oh, yeah, right. That's interesting because I remember reading that in the excerpt and it really stuck with me because, it's not that they don't want those connections, right?
Exactly. It's more like, the actual mechanics of social interaction. They can feel really overwhelming for them.
Yeah.
Like imagine trying to navigate a social situation, but it feels like you're blindfolded and everyone else has the map memorized.
Wow, yeah. That's a really powerful image.
Right. That's kind of the everyday experience for some women with autism. And so it's no wonder those situations can be so draining for them.
Yeah, totally. It's like you're expected to do this intricate dance, but nobody gave you the steps.
Yes,
Yeah.
exactly. And that constant effort to decipher all those cues to react the right way, it can be exhausting.
Oh, for sure.
So again, it's not about not wanting those connections, It's more that the how-to, the nuances of actually making it all happen in real time, that's where the struggle is.
That makes a lot of sense.
Yeah.
And it's not just about the social stuff either, right?
Right.
The excerpt, it also talks about how special interests, which that's a big part of autism, right?
Yeah.
How those can manifest differently in women too.
Oh, yeah, absolutely. I mean, we often picture I don't know, like a kid who's obsessed with trains or something. Like that's kind of the classic image.
Yeah.
But for women, their passions, they might blend in more with what society considers, normal. And that can actually make it harder to recognize.
Oh, okay. I need an example. What would that look like in the real world?
Okay, well, picture this. A woman who is deeply into historical fashion. I'm talking she spends hours like researching these old sewing techniques, recreating vintage pieces, maybe even traveling to museums just to like see historical garments up close.
So on the surface, it just seems like, oh, that's cool. She's really into vintage clothing.
Exactly. But underneath, it's that same intense focus, that drive to learn everything that's a big hallmark of a special interest, you know?
Right.
And it might not seem as disruptive, I guess, as like, you know, the kid with the train obsession, but it's important to realize those passions, they can be like a double-edged sword. They can be this incredible source of comfort, but also, you know, if they're not nurtured in the right way in a supportive environment.
They can be a source of anxiety too.
Exactly.
That's a good point. And it just shows you how important it is to really move past those stereotypical images we have about autism and really appreciate how differently it can actually look, especially in women. But I think as much as we're focusing on understanding and busting those myths, it's also really important to talk about the challenges that can come with getting diagnosed later in life, you know?
Oh, absolutely. You know, getting that diagnosis, it can bring so much relief.
For sure.
Like finally validation. But at the same time, there's often this wave of grief that comes with it too, you know?
Yeah.
All those years of struggling, maybe feeling like you just didn't quite measure up and wondering why can be really tough.
It's really tough to think about, you know? Yeah. All those extra challenges, not just from living with undiagnosed autism, but also from like potentially years of feeling like you just don't get it, like you're somehow failing.
Yeah, absolutely. And all that masking, it can really like come back to bite you in a way. Yeah. The article talked about, you know, anxiety, sensory overload, trouble managing emotions. It's like trying so hard to fit in can actually lead to a whole bunch of other problems.
Exactly. And it makes you realize how crucial early diagnosis and support really are. But what about the women listening right now who are like, oh my gosh, this is me? Where do they even start? It can feel overwhelming just thinking about it.
Yeah, for sure. But luckily, Cheapaba, they give us some practical steps, you know? Like they don't just leave us hanging.
Okay, good.
They say that first thing is talk to a healthcare provider. But, and this is important, not just any provider will do.
Right.
You really want to find someone who gets it, you know? Someone who's knowledgeable about autism in women specifically, someone who understands all these nuances we've been talking about.
Yeah, that makes sense.
Because they can, like, really give you an accurate assessment and connect you with the right resources and all that.
It seems like finding that right support system, like people who get it, is so key in all this.
Oh, 100%.
And the article also, it really stresses how important it is to get mental health support, you know?
Yeah. Having a therapist who understands, who truly gets the unique challenges that come with being an autistic woman, I mean, that can make all the difference.
Yeah.
They can give you tools, strategies, you know, to deal with things like social anxiety, sensory overload, all those emotional regulation struggles. It's about helping you feel more in control of your own life, you know?
Yes. It's about learning how to thrive as your authentic self.
Yeah.
It's not about trying to force yourself into some box that you don't fit in.
Exactly.
Right? And I really appreciate how Cheapaba makes that point.
Yeah.
That seeking help, it's not about fixing yourself.
It's about understanding yourself.
Yeah.
It's about gaining this like invaluable self-knowledge and then having access to that support system that allows you to live a fulfilling life, but on your terms.
Yes. So for anyone listening who feels like maybe for the first time, things are clicking into place, you know, like, oh my gosh, this explains so much. Just remember this. You are not alone. And taking that first step, reaching out for support, it could be the most empowering decision you ever make.
Couldn't agree more.
It's about like really honoring your own unique neurodiversity and building a life that celebrates, you know, the real you.
Beautifully said. And you know what? This journey of self-discovery, it might even lead you to a whole community of people who just get it.
Right. Finding your people, a place where you can truly be yourself.
Exactly.
That is a beautiful thing.
It is.
And sometimes all it takes is a little bit of information, you know, like a little spark of recognition, and that can be enough to start this incredible journey.
Love that.
Well, that's about all the time we have for today's deep dive, but a huge thank you to our expert for sharing these incredible insights.
My pleasure. Always happy to be here.
And to everyone listening, remember to check out the show notes for links to Cheapaba and all the other resources we talked about today. Until next time, take care.